Good afternoon, everybody. Welcome to our first webinar of the year on the role of chemistry in sustainable medical textiles. Thank you for joining and taking your time to be with us. My name is Katia Pagella. I'm the Circle Healthcare Projects Officer here at Healthcare Without Harm Europe. And today I'll be moderating this session. Before to get properly started, let me say something about our organization. We are Healthcare Without Harm Europe. That is a non-profit European network of hospitals, healthcare systems, professional bodies, and health organizations. In a nutshell, our mission is to create a sustainable healthcare sector that does no harm to patients or to our planet and acts as a catalyst to protect human health and the environment. Healthcare Without Harm also includes 3 regional offices that develop regional work and initiative in Europe, Southeast Asia, and the United States. And we also have regional partners around the world. Together with our European members, we are also part of the global movement, Global Green Healthy Hospitals. That is an international network where our members can connect via this platform. And is a network of hospitals, healthcare facilities, health systems, and health organizations. So why this webinar today? As I said, I'm part of the Circle Healthcare program, and within our team, our mission is to apply the circular model to the healthcare sector by extending the life cycle of healthcare products, respecting the waste hierarchy, but also to try to integrate also a toxic-free hierarchy, where the medical products do not contain harmful chemicals. In this context, one of the subjects we have been working on recently is the role of these chemicals in medical textiles. We published this report in December, and with this occasion, we decided to launch this webinar and dig into the issues and points with our experts. So the aim is to provide an overview and highlight the importance of addressing the chemistry in medical textiles to move towards the phase out of these chemicals. As you can see in the picture, the impact of health and the environment is clear in the linear model, and also the use of chemicals has a really high impact from on each stages of the life cycle. So there is an urgent need to apply the safe by design principle to redesign and to shift towards the toxic-free reusable products. So medical textiles are typically made from all major forms of textiles: fiber, yarn, woven, also woven or non-woven fabrics. And we will see this later with our first speaker. But to meet these varied and important requirements, chemistry really plays a crucial role, because we really need to identify these chemicals to understand the performance and the properties. And indeed, medical textiles are often treated and contain harmful chemicals, including toxic or endocrine disrupting chemicals, as, Ptfe, plasticizer, biocides, or flame retardants. So, generally speaking, medical textiles should be toxic-free and demonstrate properties related to their use. So we really need to understand the chemistry behind and the properties that they have to meet for their scope and their use. We are also talking about textiles that are used to treat injury and to support clinical treatment. So you can understand the subject is quite sensitive, and medical textiles are therefore typically focusing on performance, comfort, hygiene, patient safety. So we need to understand this property depending on their purpose. So here, I know it's an awful table, but just to say that if we take a snapshot on the chemicals found in textiles finishes, we can find many harmful chemicals that need to be addressed based on their function and the essential use. So when we really need to use these chemicals. But this is also another concept that you will see later with our speakers. So yeah, also there are further substances here that are used for, plasticity, water resistance, flame retardancy, and they can also contain plasticizer, or impurities. So let's go to our speakers. So thanks to them, we will dive into the main key message of the report that we released in December. So we'll start with Holly Morris, surgeon, medical textile specialist, fellow of Textile Institute. She works closely with academia and industry, and she already has several publications in professional literature that we have also included in our report. So she will really answer to the question, what do we need to know about sustainable medical textiles? Then we will learn from Stefan Posner. He is a polymer and textiles chemist with over 35 years of experience in research on chemicals in textiles and polymeric materials. So with Stefan, we will learn more on the challenges in chemical management, so more on the regulatory aspects. And last but not least, Tura Hevellen, Environment, Health and Safety at Oslo University Hospital, specialized in chemical management from procurement to waste. He also covers a part-time position of chemical advisor at the Norwegian Hospitals Procurement Trust. And today he will share with us the European healthcare phase-out list, and we will see how we can help procurement organizations across Europe to select safer alternatives products for healthcare sector. So please leave your questions in the Q&A button, and we will take them at the end of the session. I think that's all I have to say for now. I will time to stop sharing my screen, and I need also a glass of water, and I will give the floor to Holly. So Holly, the floor is yours.
Thank you very much. And I will just share my presentation. Here we go. There we go. Can you see that now?
Yes, Holly. Yep.
Brilliant. So thank you very much for the introduction. I'm Holly Morris. I'm just finishing surgical training as a trauma and orthopedic surgeon. And I've also got a dual specialism in that I work with the Textile Institute. I'm one of their fellows, and I have an interest in my area is healthcare and medical textiles. I've done several publications along the way, and I also work with academia and industry in developing new healthcare textiles. I'm also sitting on the Royal College of Surgeons sustainability group as the textile expert there, where we'll be putting in recommendations for textiles within healthcare to affect procurement. So today I just wanted to talk a little bit about medical textiles, what they are and what they cover, just so that we're all speaking from the same hymn sheet. And there are some definitions of textiles that the Textile Institute have as their set definition. Medical textiles are textile structures that effectively have been developed and used for a whole variety of medical applications. They might be implantable applications, they may be non-implantables, and they may also be some of the peripheral devices that you wouldn't necessarily think of as well. So medical textiles is one of the newer textile fields. It's an emerging subspecialist field, and it was first recognized relatively recently by the textile industry back in 1995. And you can see how fast it's growing just by the sheer body of literature and number of papers that have been published, particularly in the last 5 years. We've had a sudden increase as well with the COVID pandemic and publications around PPE. And the vast majority of these recent publications are all looking at antimicrobial textiles. And as nanotechnology and the advances in both knowledge and what we can do have progressed, there's been more attention turned towards the antimicrobial and antiviral textiles. So currently medical textiles is the fastest growing sector of the technical textile industry. It's been going to double between now and 2026. And I'm an orthopedic surgeon. Just to give you an idea, I mean, we're an expensive surgical specialty because we put all the knee and hip implants in. But equally, the global market for orthopedics in 2019 was still only $45 billion. So you can actually see how large an industry technical textiles is for the healthcare tech. And as I alluded to earlier, that growth has been driven by a combination of factors such as the technology, the demand, and more recently, the political agenda and moving towards sustainability. So Wang in 2016 defined the medical textile field as having 5 separate areas. Implantables, these are things like the grafts, the bioscaffolds, the sutures. We've got the non-implantables, which in particular are your pressure garments for VTE prophylaxis, such as your TED stockings, some of the dressings, bandages. The 3 other areas include healthcare and hygiene. So this is everything from the wipes to wipe down hospital equipment, to wipes to wipe patients, PPE falls into this category. There's also some weird and wonderful, so dental floss, things like feminine hygiene that people wouldn't necessarily first think of. We've got the more invasive textiles, so your ECMO devices, artificial biopancreas, your dialysis machines, and then the smart textiles, which is a new growing field within medical textiles. It overlaps nicely. And these are textiles that can sense and then can actually actuate a response. I've just updated this in my latest publication. We've added another 2 areas we've looked. So just to try and simplify things down, we've added in furnishing fabrics and textiles. So these are things such as chair covers, the curtains that you see between patients' beds in the ward, because actually they can harbour bacteria and they can harbour microbes. And the second one are the components of the devices that we use for environmental hygiene control. So in particular, the HEPA filters, air filtration, and things like that. And there's been a lot of attention turned towards that with the pandemic. But actually in orthopedics, we were concerned with it before because of the risk of implant infection when we're operating. So when we're designing, there's a whole series of things that you need to consider, and it's not just the product itself. There's obviously a lot of legislation behind the product. There's the intellectual property, there's the design process itself, there's the risk stratification, because nothing is perfect. And so you can strive for perfection, but you need to modify the risks when you're not meeting that. And then you've got other things to consider, such as the ergonomics of actually using the device, and then the whole compliance and regulatory structure. And that varies a little bit between countries, but it's all broadly along the theme of keeping both patient and user safe. So how do we create a textile? Well, we often start with a fiber, and that could be natural or synthetic. And from that, we make a yarn and then make a fabric. And then from that, you can make a garment or a device. And when we're doing these things, we need to be thinking about what we actually want the device to do. So is it the most important thing is how it looks, so the cosmetics of it, or is it actually the functional properties? And they might be biological, particularly for the implants. A lot of the problem with implants is that they tend to cause thrombotic reactions and can cause blood clots. And they also tend to activate the immune system. So often implantables need to be antithrombogenic and immunosuppressant. You might want them to have antimicrobial properties as well. And we've also got a whole series of medical textiles that can act to elute medications and so have pharmacological properties. Away from the biology side, you might actually just want something to be mechanical. So such as the mesh that we use in hernia repair. Is it strong enough? Is it going to stay strong enough whilst the body heals around it? Is it durable? What problems is it going to cause later on? And again, you've got to consider things such as the physical side of the textiles, particularly if we're going to be laundering, because that can often affect physical properties of your cottons, your polycottons. And if you're going to make something like a surgical gown, then you do need to get it past a certain amount of washes for it to be reusable. And obviously, the more you can wash it, the better it is potentially, because you're only creating one but getting much more shelf life out of it. So fibers and filaments, we've got 2 broad categories. We've got the natural and the synthetic. And natural really can come from animals. I think everybody's well aware of wool. Different breeds of sheep breed different wool. We've got the silkworm there, one of the most expensive fibers out there, and also spider silk. And there's a lot of work towards recombinant spider silk, particularly in the role of bioscaffolds, wound dressings, things like that. We've got, rather than animals, we've got our vegetables. So we've got cotton, we've got kapok, we've got bamboo, and then we've got some things that people don't necessarily think of. So casein from your milk, collagen we can use, got weird and wonderful things here, so sugarcane, eucalyptus, all sorts of things, and then sort of diving into more weird and more wonderful seaweed, from which we can harvest alginate, used a lot in wound dressings, and from the crustaceans we can harvest chitosan, which again has been used to a reasonable amount in bioscaffolds. And then you've got things like your rubber. So really we do have the weird and wonderfuls. If we move over to the synthetics, nylon, and there's different forms of nylon depending on the actual chemical structure, but there's also a whole range, polyesters, polypropylenes, and then more recently we've got some very fancy different synthetic polymers. So these are dendritic molecules, and within them you can hide other molecules that can function to do various things. So they could give a color, but more often than not, they will have a function such as delivering a drug or delivering some sort of property. And they may be designed like this one in the middle so that it dilutes out at a particular time, or they may be covalently bonded onto the actual molecule itself. And then we've also had some real novel progress. So graphene can conduct electricity, and that's allowed us to drive through the smart textile field as well. So various ways of making yarns. Sorry, if I just go back, that's me when I lived in New Zealand on an old-fashioned spinning wheel. But actually we've got the industrial processes, and then we've got the industrial processes here for your synthetics. And there's a range of different ways to make yarns. And we've also moved on to the nano fields with the electrospinning for nanofibers as well. And so from that, we can do a range of things to make a fabric. And the other important thing to point out at this stage is that you can finish the fibers at any point within this. So you can start adding molecules at the fibers stage to impart properties, or at the yarn, or you can wait until you're right at the end before you do something that confers a certain characteristic to your fabric. So in terms of making a fabric, the main three are your weaving, your knitting, and your non-wovens. And weaving, I think everybody's au fait with. It's most likely that the shirt, if you're wearing a shirt, is a woven fabric. How you weave the fabric will alter mechanical properties and also some of the physical properties of laundering. People wearing jumpers, they're most likely to have been knitted. And again, there's a whole range of different stitches that will give you different properties. And your non-wovens, there's a whole different array of ways of making non-wovens, but essentially the fibers are arranged in a random pattern and then compacted together by a variety of methods to produce your fabric. And in healthcare, it tends to be disposable gowns and drapes that are non-wovens. There are other options. So there is braiding, and we use braiding in some of the ligaments and the artificial ligaments, but that's much lesser so. And then, as I spoke about earlier, we can finish the fabric, and there's a whole different range of things that we can do. And these often will alter some of the properties of the fabric. So it's important to have a grasp of how textiles behave at different points. And you can do things such as treat them with surface modification. You can do molecular biological imprinting, and you can sterilize. And there's a whole different range of ways of sterilizing. And then once we have a product, it does need to be tested to the determined standard to prove that it's safe for use. So applications, I went through a whole range, but I'm really just going to focus on some of the main ones that we're going to cover in this webinar. And that's looking at the healthcare and hygiene category in particular. This is the one that creates a lot of waste in terms of PPE and the disposable PPE, surgical drapes. You've got lots of linen, bed linen, patient and staff clothing, a whole range of things there. And just really to allude to, there is manufacturing in the UK still, and you see it's large factories producing and then producing some of our gowns that we're wearing, which I think we're going to talk a little bit more about later today. Thank you.
Thanks a lot, Holly. Brilliant. Yeah, I'm sure we'll come back on some point later, but thanks a lot for this comprehensive review. I will give the floor to Stefan Posner, and I will share the presentation for you, Stefan. Just 1 second.
Yep. Thank you, Katja and all. Stefan Posner has already presented. I'm a polymer and textile chemist, as Katja mentioned, for 35 years experience, and also since almost 25 years I've been doing preparatory work for legislation and been a scientific advisor for many years for the Commission, and the last 10 plus years for the Stockholm Convention on hazardous high environmental impact chemicals, mostly addressed to textiles, but also to other kind of materials. So I call this presentation Chemical Management in Practice, and we can keep this slide because the Green Deal, as I mentioned here, is going from plans to actions. Sustainability is eventually actions by the end of the day. and I will guide you through some key points in this context with the chemicals new policy that was decided in October 2020. And there will be a presentation by the Commission to revise some parts of our legislation and go forward by the end of this year. So a lot of things are happening. So I will go through transparency, traceability, and origin of materials, products. And in that context, I will discuss, I will shortly present the complex value chains because they are really complex. The new view on chemicals, we cannot, due to time, look at each individual hazardous chemical. So grouping of hazardous chemicals are at hand. We have, for instance, Ptfe, fluorochemicals. We have endocrine disruptors. There are ongoing identification of these chemicals, quite a number of chemicals. So grouping is a key word. One thing that is stricter than it used to be in the regulatory work is the focus on relevant hazardous chemicals for their purpose, use, and occurrence. It would be a stricter regime how they are actually used, the chemicals introduced to the European market, and also as a good example for the global market. I will discuss a bit about essential uses and strategic value chains. Essential use is ongoing work by the European Commission for a legal definition, but I have some drafted points I will show you a bit later. We talk about effective chemical assessment and substitution means that we really have to know quite a lot more about those chemicals we are assessing to make a proper and non-regrettable substitution. And eventually I will example with two cases, actually ongoing work in the broader PFAS restriction work where I'm representing Sweden on PPE and medical applications. Next slide, please. Yes, this is a simplified value chain. And you can imagine if we don't have an idea where things are going, our communication will be in a black hole. And that's what unfortunately happens already today. So the real value chain is much more complicated, just an illustration. And many of us really don't know where our information is moving, where our products are coming from. And things changes, suppliers change, the process owners change. So have a strict regime with requirements is quite challenging. So you can press the button, Katja, and yes, that's perfect. So what we are aiming at in the value chains is to provide consistent chemical information, and that includes knowledge, that includes what we are doing, we're understanding of those hazardous chemicals in focus that are hazardous and relevant for those particular value chains and the functionalities they provide. Next slide, please. So that was the value chain, and I will talk a bit about what are bad chemicals in this context, used in the regulatory work, but also among a number of companies, associations when we talk about hazardous chemicals. Next slide, please. So when we have bad chemicals, of course, they are identified due to their hazards. And now, and especially in the future within the Green Deal activities, we really need to understand how these bad chemicals are actually used and their functionalities, because it will be less acceptable to introduce these kind of chemicals with no specific purpose and no specific identification. So bad in this case means CMR, cancer, mutagen toxic, reproductive toxic, endocrine disruptors, allergenic substance, both skin and air, And we have these environmental impact chemicals, the persistent, bioaccumulating, and toxic. And for the fluorochemicals will be introduced in the next version of REACH, persistent, mobile, and toxic chemicals. For some of these chemicals, new industrial chemicals, if I put in brackets, they don't behave like the old industrial hazards. So new impact and hazard terms are considered. Next slide, please. So this is more a formal view on worst, worse, and bad. These are the hazard statements as they are used today in safety data sheets and in communication on chemicals produced and imported to the European market. A bit different from other parts of the world outside European market, but these are more or less harmonized. And as you can see, we don't have a hazard statement for endocrine disruptors, hormone disturbing called in daily life, but this is ongoing, and also chemicals that provide these serious properties. And to scale them, what is more serious, what is unacceptable for those exposed to these chemicals, and what is less critical for those exposed to these chemicals. So this is the current scale. It's looked at, and this might have an impact on safety data sheets and the classification of chemicals in the future. Next slide, please. So how do you make priorities in your value chains? Next slide, please. So we have a number of chemicals, and in the CAS system, which is a voluntary huge system, where chemicals, new chemicals are registered. I think there are 15,000 CAS numbers registered every day. So it's more than 150 million CAS numbers, the identity number of each chemical, quite a number of chemicals. And we have quite good knowledge, well, knowledge at least, of around 20,000 chemicals that are CMR, cancer, mutagen, reproductive toxic, hormone disruptors, PBT chemicals, very persistent, very bioaccumulating, and allergens. And around 10%, a bit maybe less, are regulated. And there are different regulations in different parts of the world, but I mean, around 1,500 in the European Union. And this elliptic way of chemicals of your concern, this is the relevance. And this is the focus of what we call functional chemicals that may pose this hazard. And this ellipse is by purpose overlapping unknown gray area hazards that are not regulated and regulated chemicals. So the big challenge here is to identify and understand how your hazardous chemicals are, what they provide, and where they occur in your value chains. Next slide, please. So just a very quick one on this slide. We have different categories of chemicals. We have those that are intentionally used as such. We have processing chemicals, solvents, for instance, that don't provide any properties to the final product. And we have unintended impurities, breakdown products. And when we communicate with value chains, we cannot say actually that do you use that in unintended chemical. You don't say unintended chemical because they are not actually used as such. So this is a part of the knowledge provision in the value chain. Occurrence is a good word to use here because we don't understand to a full extent what is actually used, what appears in the value chain, and what is occur as at one stage an impurity, at one stage in the value chain as an important process chemical. So we have to clarify this terminology a bit, but that's ongoing, and it's worked on in quite a number of value chains, as far as I know, by companies. Next slide, please. So, essential use of chemicals. This is not the legal definition, but at least it's a very first raw draft of what we mean with essential use, in the context of in the regulatory work. And it's nothing to do with commercial issues. It's actually 3 points, which will be elaborated further, of course. one for health and life protection, when critical for the functioning of society, and where no available technically and economically feasible alternatives are available. The last point also means that we cannot do regrettable substitution, change one hazardous chemical to another. If all these criteria are fulfilled with a deeper meaning and in a comprehensive definition, we have an essential use. And those chemicals, though they are hazardous under normal conditions, cannot really be excluded from society. They are probably included in what we call strategic value chains. And in the area of medical textiles, medical applications, there are a number of examples where this essential use hits these uses. Next slide, please. So if we want to really to substitute, want to realize sustainability, which is the aim of the European society at least, is to have guidelines, very concrete guidelines, how you shall do, like a book with recipes. And the first important criteria is technical performance. If you change the technical performance to something less technical, that doesn't really work. That's a very serious criteria, because one of the most important points is that you have equivalent technical performance with an alternative chemistry, or it has not even to do with alternative chemistry. It could be a combination of materials, material design, but the technical performance should be maintained under a very long time. Long life is very positive. As the previous speaker indicated, if you can use a textile, for instance, a very long time, that's positive for sustainability. Okay, of course, the health environmental performance to describe risk scenarios, very important. And in this case, we lack data when we do assessments on hazard and impact. And this has, of course, an impact on the risk assessment under normal use. So there is information lacking, but there are improvements going on. Precautionary principle. Some say that the current legislation in EU doesn't deal with the precautionary principle. Of course it does. If you have no data, enough data on the table, you are absolutely allowed to use the precautionary principle. Of course, there is a gray zone where you can make a decision, the weight of evidence, the load of data you need, etc. But we can never know everything about every chemical. That is impossible. So at some point, we have to apply the precautionary principle. The current legal work is based on a holistic perspective, means we go to the whole life cycle and look at hazards, impact, etc. That has also to do with how these chemicals are actually used. And one thing that is important, I think also important for sustainability economic considerations, are life cycle costs, which is a bit different from a price tag. And we talk about cost effectiveness, and in the socioeconomic analysis, which is every time a part in the regulatory work, these considerations, life cycle costs, are considered to see if there is a balance between benefit and risk. Next slide, please. So how shall we go in this range? Of course, identify in certain cases which are the hazards, and the list, the table Katja showed in the beginning of the seminar, indicate the number of hazards that have relevance to medical applications. But we need to identify specific hazards for specific applications, which are of course related to their technical performance. We need to understand where they're used, how they're used, and where they occur, and to what extent their hazard potential. And identify whether there are replacements or substitutes, if they are non-essential or not. And this assessment has to be carried out. And if you find them essential on a scientific basis, they cannot be replaced. And from a legal perspective, if they are really essential, they would probably be exempted in coming regulations. Next slide, please. So some legal aspects. Next slide, please. I got the question a number of times. What are the big differences between regulations in different parts of the world? Yes, in detail, but not in general. Every part where you have a chemical regulation, everyone is actually looking for specific hazards and unacceptable risks, because that's under normal foreseeable conditions, as it's called. If a chemical shows a high risk under normal use, these chemicals are for restrictions, regulatory actions to some extent. So my quick answer to differences in regulations worldwide, yes, in detail, but not in general. So next slide, please. So when we deal with new regulatory actions and look at ongoing that has to be revised, there are some key marks that has to be done. When an ongoing restriction that is already published has an overview, a review. Maybe alternatives have appeared on the market that might change the situation for a certain restriction of a group of chemicals. And we have a better understanding how these chemicals are used over time. And at some point over time, there might be a non-regrettable substitutes available on the market. A substitute has to be emphasized that it's a commercial chemistry or commercial applications that are as fully available as the old hazardous chemistry that is under scrutiny. So these are looked at when the review processes are ongoing, regulatory review processes. Next slide, please. Okay, I have two examples here. Ongoing work with a broader restriction on PFAS, the PPE, and those applications that are in focus and probably essential are what we call the high-risk category 3 in the PPE regulation that are really about life and death. And these point at protection against liquids, gases, chemicals, aerosols, and microorganisms for firefighting, law enforcement, and military. And of course, chemicals that are for maintenance for hospitals to maintain the what we call an essential property, oil, low surface liquid, low surface tension liquids. So these kind of category 3 high risk applications are under discussion for exemptions in the broader PFAS work. And of course, there is always the discussion, the balance between the technical benefit and the risk. And if the benefit is higher than the risk, there is an exemption. And of course, an essential need for these chemicals. Next slide, please. So we have for medical, I looked into a number of cases here. There are actually, by the new OECD definition that came last summer, there are pharmaceuticals that are actually PFAS. If you look at the chemical structure, and I'm just mentioning them, that I've not been dealing in detail with these applications, but it depends how far we go on the line here. But there are some PFAS pharmaceuticals, and if I guess that they are quite important to be used, but maybe not. I'm not a pharmacist, so I shouldn't say that. Okay, processing aids for Ptfe. polytetrafluoroethylene packaging materials. And you can see in the text below there have been the non-fluorinated alternatives, but they were not able to provide the equal performance, which could mean that this example reprocessing age for Ptfe might be essential, since the technical performance, in this case, reading the text, probably failed. Precision cleaning in medical devices. And there are other examples, other alternatives than PFAS, where you have ozone depleting solvents and high global warming, hydrofluorocarbons. I would say also that these hydrofluorocarbons are within the scope of the broader PFAS regulation. So it depends. You go from from worst to worst. So we have to look what are really the alternatives. In this case, with precision cleaning, it might be a regrettable substitution. Surface treatment, it's another example we look at, I guess that there are, I will not have any specific comment on that. I saw that in the background material I'm working with. But so it's not only textiles, medical textiles, there are a number of instrumentation and applications where PFAS are used. And I cannot conclude here whether that these are essential or not for the technical performance of this equipment. Medical coolers, freeze dryers to preserve biological samples, all this sounds very important. And this is ongoing to understand if replacements, substitutes are regrettable or not. Next slide, please. And that is a thank you in many languages. Thanks a lot.
Thanks a lot, Stefan. And I'm sure we'll come back on some point also later, especially on the essential use. Also because you touched a lot of points that indeed will be reviewed under the REACH revision 2.0. So for the moment, I will pass the floor to Tura. And just one moment, I will share the screen.
Yes, there it is. Okay, yes, my name is Tore Havel. I am representing the Norwegian Hospital Procurement Trust today. I'm going to talk about what we are doing to reducing the amount of hazardous chemicals in medical textiles. So next slide. Yes, our first priority, if we are trying to use as many products with this transparent third-party certification, like the Nordic Swan or EU Ecolabel, if possible. If you, this is not exactly textiles, but in disposable bags, tubes, and accessories, we know that they are looking for they have this prohibition of the materials of PVC and latex, siloxanes, phthalates, and chemicals that are environmental toxic, allergenic, endocrine, or CMR. And they should also comply with the EU Medical Product Directive and the Medical Devices Regulation. Then we know that if they have this label. So it's quite good to try to get as many as this product as possible. The same is for hygiene products like diapers and incontinence care products and disposable covers. They are mostly all are have this Nordic Swan label. Okay, Next, please. When I looked at these 7 categories in this report, we saw that we asked this Nordic Swan to say which of them where we could find some labeling, and it's in this healthcare and hygiene products like bedding and single-use bedding for operation, clothing for staff and patients, single-use clothing for patients. And in the non-implantable materials, we find the bandages and plasters that have this swan mark. And in textiles in healthcare environments, we can get mattresses and furniture that have this Nordic Swan label. So if they have that, we prefer to buy these products. Okay, next slide. Most of the products that we are buying doesn't have this label, so then we have this European healthcare phase-out list for chemicals of concern, and that includes the chemicals that are on the candidate list, CMR substances in category 1A and 1B, PVC, phthalates, bisphenols, flame retardants, antimicrobial agents, and these PFAS that we are talking. So we are, 2 seconds. We put this in our tender and to say that these are substances that we don't want to have in our products. So next slide, please. Yes, so this is an example that contains a lot of medical textiles in our most recent tender for operation products. It contains lots of covers for a microscope and beds and things like that. It contains these beddings and Ptfes and yes, and compressors, and yeah, lots of typical textile products. It's a contract that consists of 41 subcontracts, so it's a quite big one. Yes, next. Yes, thank you. And this is what we put in this tender. So at that time, we had we said that the product should not contain any candidate list, phthalates on the candidate list, restriction list, and sin list, bisphenols, PVC, antimicrobial agent, latex, and we had also these additional requirements, and that was PFAS, but then that was on a time where PFAS was not on the list, but as it is now. And also allergenic substances like rosin and lanolin. Before we had this tender, we have this market dialogue, and when we talked to us, and there was only 4 subcontractors that they needed to have some exemptions, and this and that's not any textile, but it's more like these suction sets and something like that. And we said that they had to phase out the candidate list products and phthalates by contract start, and then they will have to do that. And And we had this award criteria on PVC with 30% weighting. The result on this is that it is still PVC in these products, but it's not that much on this whole large tender. We had also an additional requirement for drapes, and where we said that they get they had 20%, if they had 20% bio-based material and top layer minimum 70% bio-based, they got this 40% weighting on this tender if they had that. So this tender shows that it isn't that hard to get all these it isn't that hard to get rid of lots of these hazardous chemicals in the operation products. I think I'm a little bit surprised that it was that small amount of PFAS in the product. I would suspect it was more. But then we also they are just answering. If it's more than 0.1% in the product. Okay, we can take next slide. Yes, this is an example of that the devil is not in the detail. Everyone who has to put in an offer to this tender has to fill out this form, environmental form, and it is on the left. They have to put up all the products they are offering, and if it contains these candidate list substances, and if it's a PVC in it, is it bisphenol, is it latex, and so on. And we also have this column for if it's environmental label. And then it's either yes. So we got lots of these forms, and we are when we are putting it all together in Excel, and then we get their results on the tender. So we can easily see who is giving us products with chemicals we don't want and not. Yes, I can have next slide. There are lots of times we have to use these products because they have a function, and we are giving exemption when there is a medical reason. It's desired. And we are not exactly giving it because it's a lack of alternatives on the market. But then we say that if you get another one without, for instance, PVC, we are taking that when it comes. But lots of times you have these antibacterial agents in sutures, for instance, triclosan. They are using it to reduce hospital infections. And people who get these fire wounds sometimes need to use this antibacterial wound dressing containing silver. Yes. At the operation, there are lots of surgeons who like to use latex gloves, and they can have it if they want to. So, but then our main use is nitrile gloves for most of the people. I think it's approximate 90% nitrile gloves and 10% latex that are in use at the hospital right now. We also accept flame retardancy in furniture and curtains, for instance, in psychosomatic units. It can be good if the patient wants to fire something up. It's nice. It's not that easy. Yes. Okay. Next. What we are thinking right now about these textiles is our concerns and what opportunities there are. Is that one thing is it's a huge amount in use, and the problem with these products is that there are some limitation to recycling. It's either hazardous waste or it's very complex products that consist of lots of different materials. So it usually goes to burning. There's not that many eco-labeled products that we want, but we hope that there will be more in the future if we are trying to ask for it every time we have these tenders. And the second is that the more who uses the European healthcare's phase-out list, we are going to increase this product availability that with these products that contains these hazardous chemicals. And another thing is that since it's often these complex products, I would like to have some like product database or product passports that says how much and what is in these textile products. So it's easier for us to see what possibilities there are to use it or to recycle it, and what are our climate footprint by using all these products, for instance. And yeah. Yes.
Thanks a lot, Tura. Thanks a lot. Thanks for showing this practical tool. And indeed, for information, if you check the chat box, you will find this phase-out list that Tura shared, and indeed it will be our work to share again. And I remind you that it is also open for endorsement. And indeed, this is a practical tool to streamline the tenders criteria, and also I think is a push for the industry, to boost the innovation and to look for more alternatives. As Tura said, sometimes it's quite hard to go for the alternatives, and when also is required, and when we have to deal with higher performance, for example. Okay, so I think we have 2 minutes to check if there are any questions. I saw that we already addressed some questions in the chat box, but probably it will be nice if we can come back really quickly on the essential use. I can start with Stefan, but please, Holly and Tura, feel free to jump in. I mean, it's nice to have 3 different points of view. Stefan, I saw that you shared these criteria about the essential use, and indeed it's quite critical now with the revision of REACH. So my question is how to ensure that this concept of essential use will not be abused, for example, by the industries, because I think that can be also somehow reviewed from the industry or applied in more products. And for us, indeed, it's quite important, for example, to subcategorize some products, probably like antimicrobials we don't need in every products maybe, but just in the critical categories. I don't know, would you like to comment on this?
Yeah, it's a very hard question to answer shortly, but this is fact-based and not commercially based, the essential use. And if the industry cannot provide proper facts, it will not be exempted. Essential equal to exempted. So conclusively, very few exemptions will be provided. There is a high how do you say it? There are high requirements on the industry to get this exemptions. So abuse is always a risk, but we try to avoid this as best as possible.
Yeah. And Holly, Tura, would you like also to comment on this? Tura, yeah.
No, I'm not sure what to say. Sorry.
Yeah, indeed, it's not easy. I mean, let's think about it, yeah. And Holly, I don't know, would you like the experience that you have also with the research, how you face this concept of essential use? Because, I mean, it's a really endless debate. It's still not defined.
I think one of the complexities for, say, myself as a surgeon is what might be essential use to me is not essential use to a physician or to other healthcare professionals. So it becomes increasingly complex, and you almost need to look at a more sort of a narrow range as to what we actually use. There's a question gone there about how do you have strategies to avoid overuse of silver dressings? I never use silver dressings, but I suspect the plastic and burn surgeons use them quite a lot, and rightly so for the need. And the issue is it's not necessarily completely phasing out everything. It's actually thinking about what you use and why you're using it and making sure that the right dressing is used for the right circumstance. And I suspect that is what needs to change. So it would be through education.
Great. I don't know, Stefan, you want to add something else? Okay.
I had this, I hadn't a question. That's why I couldn't say anything. But what I would like to say is that it's very important that we are accepting essential use, because every time we say no to any products they like, then we are getting these, they're not very fond of us. But our main goal is to reduce the amount we are using. Yeah. So when we can do that, it's very nice.
Yeah, that's the first priority indeed. We risk to just associate essential use to the medical sector, but we really need to discern this and, really go in category per category, because, otherwise we get a paradox, right? Only the essential use for the medical sector. Okay, perfect. I think we can close the webinar here. Thanks to all our speakers and to our participants. If you have additional questions, you want to get in touch with us, here is my contact. Please don't hesitate to email me if you have any further questions. So if you also want to work with us on this issue, we have also a working group on medical textiles. So please feel free to get in touch with us. Once again, thank you so much to our speakers and also for participating in this webinar and sharing the experience with us. Have a good afternoon. Bye-bye.